Good afternoon and welcome to Virtual Face to Face with President Bruce Jarrell. I'm Alex Lukowski, Executive Director of Media Relations. Less than a year before the start of the COVID-19 pandemic, a global company CEO expounded the virtues of telework in Forbes magazine. Less stress, greater flexibility, and of course, more time with family. So as we were locking down at home 11 months ago with telework, remote schooling, and everything else, you might have been excused for thinking that maybe a little bit of lockdown might be what the stressed out American family needs right now. Eating together, family game night together, long walks together, who knows? Well, that was the sort of idyllic image behind this April 9th headline in the Wall Street Journal. Amid life in lockdown, there's joy in having the family together. Now, in all fairness to the author, many families are finding some joy together during this time and even some comfort in sharing our sense of vulnerability with those we hold most dear. But last week, less than a year after the onset of the pandemic, the New York Times published an entirely different take on what's really happening in many American homes right now. Under the heading, The Primal Scream, the Times writes, it's not just the working from home, the record unemployment, or the remote schooling. This is a mental health crisis too. One of the three working moms who are the focus of that story says, I wish I had the energy to scream. All my energy just goes to getting through every day until I can go to sleep. Mothers, especially uncoupled mothers, are really at the brink. For 3 months just before the pandemic, and only for the second time in U.S. history, women held more jobs than men, but not anymore. By the end of 2020, women lost some 5.4 million jobs, a million more than men. About a third of women ages 25 to 44 who lost their jobs said the real cause was a lack of childcare. In fact, all of December's 140,000 lost jobs were held by women. Now, the pandemic hasn't exactly been a picnic for kids either. A closed school damages more than just their education. Schools are where they develop socially and emotionally. It's where they can avoid a traumatic household. And for far too many, it's the one place where they might get enough nutritious food to stay healthy. As a result, Brown University's Dr. Susan Duffy told NPR last week, across the country, we're hearing that there are increased numbers of serious suicidal attempts and suicidal deaths involving kids. According to the CDC, since the pandemic began, the share of kids' visits to emergency departments attributed to mental health reasons has also risen substantially. Add to that the increased risk of sleeplessness, dry eye disease, myopia from excessive screen use, worsening diets as parents resort to fast food and snacks to manage behavior. And according to the Washington Post, even a greater threat from sexual predators lurking online. The Post, by the way, also published an excellent article this morning titled The Loneliness of an Interrupted Adolescence. So concern about kids here in Maryland has prompted at least one interesting idea. A bill in the General Assembly will allow students to skip school up to 1 day each quarter for mental health reasons. No doctor's note required. On the program to help untangle things today, Dr. Brenda Jones-Harden, the Allison Richmond Professor for Children and Families at the School of Social Work. She directs the Prevention and Early Adversity Research Laboratory, where she and her research team examine the developmental and mental health needs of young children who've experienced early adversity. And joining her also is Lisa Berlin, also a professor at the School of Social Work. Her research focuses on early child-parent attachment, as well as programs and policies to support early parenting. Currently, Dr. Berlin directs the Baltimore Babies Project, a randomized evaluation of the Maryland Family Connects nurse home visiting program for Baltimore City families with infants. Welcome to you both. Well, I need to let everyone know now that this program is being recorded and will be posted on the UMB homepage, umaryland.edu. In a little while, you'll have a chance to ask your questions. Please go ahead and look for the chat button at the bottom of the screen. Select Chat with Host, write your question there, and just listen for your name. When the time comes, I'll open your mic for you, so all you have to do is speak up. Now let me introduce our host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex, for hosting this again, and I'd like to welcome all of our attendees to this session. It is a great pleasure to have two senior faculty members in our great School of Social Work, led by Dean Judy Postmus. I know these two faculty members well enough to look forward to what they have to say. We're going to try to get into kids and families and some of the things that you may be putting up with at home. I have a first grader at my home, and I can tell you, when Alex said get out of traumatic homes, I sort of know what he meant. There are times, aren't there? So anyhow, with that start, what I'd like to do is begin with Professor Jones-Harden, with a question about what do you think, what are you seeing are the greatest impacts of the pandemic on the families and particularly that you're looking into, the groups that you see?
Sure. I want to start by echoing what Alex said. I think some families are finding joyous moments and are experiencing time with their kids that they haven't had. And I think even stressed families have that opportunity. But I think the data, and there are lots of research projects about, particularly one that I'm on the advisory board for called Rapid Early Childhood, that is surveying parents every week to look at how the COVID pandemic has affected families. And what is coming out in these research projects is that families are feeling a lot of stress. Whether they're middle income or lower income, they're feeling a lot of stress, particularly women who are now juggling many, many tasks, including helping their children get virtual learning done, feeding their children, being the cafeteria worker, helping their children with mental health. So what you're seeing with these moms are increased reports of depression, increased reports of anxiety. Sometimes they're not only caregivers for the children, but caregivers for the elderly people. So they're kind of juggling this caregiving role. And in fact, there are even some reports that you're seeing increased rates of substance abuse. The other thing that we worry a lot about with families is increased child maltreatment rates. Oftentimes, particularly for young children, we know that the school, the child care center is the major referral source. Children are not at school and not in childcare at the levels that they were before. We also know that pediatricians often are the ones who make those referrals. So one of the real things we're worried about is whether families are feeling so stressed that they're maltreating their children without the kind of supports that they need.
It's all Alex's fault today.
No, I unmuted you, so don't put that on me. We're all doing it today.
Sorry. So let me move to Professor Berlin. So we just heard about families and moms. So Professor Berlin, tell us about what kind of impact you're seeing in children, particularly in these families.
Sure. I think one of the major takeaways of the impacts of the pandemic on children is how much tremendous variability there is out there. And impacts on kids will vary according to a number of factors, such as their family's socioeconomic condition, pre-pandemic and during. What kind of just basic resources are available? What kind of access to healthcare and other services are available? Has a parent lost their job, or alternatively, are they an essential worker in the COVID line of danger every day? Does the child have special needs? And are they unfortunately, cut off from services that are typically provided through school? So all these things, and often more than one occurs at a time, will really affect the extent to which that it will shape the child's experience during this time.
So there are obviously many factors that are influencing how families have done, whether they've thrived, whether they've suffered, et cetera, during the pandemic. I wonder if each of you could talk a little bit about factors that are particularly important for women, for example. And Dr. Jones-Harden, you just mentioned something about moms. Maybe you want to talk about women here first, and especially.
I think, what we know from the literature and from many of us do clinical work with moms is that women have higher rates of depression anyway. And particularly when we think about when they're parenting very young children. And it gets worse if you're a low income mom. And I think at some point we should talk about those SES disparities. But I think what you're now seeing is women who are showing even more stress and more sort of, we call them internalizing symptoms, depression and anxiety, because of role strain, really, because of so much work that they have to do to provide for their children custodially and in terms of their mental health. When you think about, for example, I just mentioned about the higher rates of depression. We know that depression affects your parenting, which affects the children's outcomes. So in terms of us wanting to give children this cocoon in this very stressful time, oftentimes mothers are so stressed themselves and there's no place for them to go. Although we do see telehealth being a strategy that certain women are taking advantage of, I just think the role strain that has affected women, particularly working women for generations, is mammoth. And I just heard somebody talking about, in a call I was on just before, of a teacher. And you know that women make up most of the teaching workforce. And this woman had 3 children at home, young children, 6, 4, and 10 months, and was trying to teach a 5th grade classroom. Just impossible to pull off.
Do you want to make some comments about low-income families since you brought that up as a topic?
Sure. I really think we can think about it. Oh, and we have a guest. There you go. There you are dealing with it too. I think when we think about any health disparities, right, we know that low-income families and racial ethnic minority families certainly feel the brunt of it. So we know that low-income families have reported higher rates of material hardship during this time, having trouble paying their rent, having trouble paying utilities, having trouble even buying food for their children. So certainly we know that low-income families have been hit hardest by this pandemic. And as Lisa talked about, they are often the essential workers, so they're worried about getting COVID and things like that. But we also know that they have higher rates of social emotional kinds of challenges, as their children do. And we know this from a lot of research that's coming out about families during COVID. Also, the childcare issue, which, you know, I won't go on and on about it, but clearly, as Alex said at the beginning of this, when you don't have childcare, it makes it hard for you to go to work. It makes it hard for you to do the other things that you might do for self-care purposes. So you have those worries as well. And if your child is able to go to childcare, you worry about infection and all that kind of stuff. So.
And as you can see, I have a little child care of my own. So Professor Berlin, how about extending this to children with disabilities and in need of special services?
Sure. I think that that's been an especially challenged subgroup of children and families, because these are kids who often are, not doing, having a particularly hard time with this enforced isolation, and also not necessarily getting services and supports that are typically available to themselves and their families, whether it's through school or through any other mechanism that's typically pre-pandemic was in person, and it has now been, shut off, or maybe, more recently occurring online or over Zoom. But, the other thing is that those kinds of services support parents too. So it's increasing the stress on parents who are juggling working or maybe not working, a loss of income, parenting, homeschooling, round-the-clock cafeteria, for their kids not to be getting the supports that benefit not only the kids but the whole family. I mean, as every parent knows, you're only ever as happy as your most miserable child. So
I hadn't heard that one, Professor Berlin.
but you're laughing knowingly.
Is there research behind that one?
Lots of research.
Yeah, I just want to remind the audience, please get your questions in, because you've got the experts sitting here. Let's take advantage of them. Professor Berlin, could you also talk about adolescence? Because I think we all know that that's a particularly rough time sometimes in people's lives. So what are you seeing about adolescence during the COVID era?
Sure. A couple of things. I mean, one, just developmentally, thinking about things developmentally, adolescence is a time of increased autonomy and differentiation of the adolescent individual from their authority figures, from their parents, from their families. If I think back to my own adolescence, I spent as much time away from my home and my family as I possibly could. And I think that, adolescents are now instead, many of them in enforced confinement with their parents. And it's really stressful. It's a real loss. On the upside, I think some adolescents are at a point where they can manage their own learning and schooling just fine, and they would rather have the flexibility of doing that than going to school. So there are some, pockets of advantage. I think some kids are learning that they can work and function much more independently than they might have otherwise thought or been presumed to. But I think that they're being cheated, and you know, hopefully as things begin to open up, they can't get that time back, but um, I think they will certainly welcome the opportunity to get some freedom back.
So thank you for that. Alex tells me we've got a couple of questions, so I'll let him add them in, and I'll keep going when we have a spot to go in. So
Okay, well, Mary Phelan's got a question that is likely to spark, if not debate, a lot of discussion. Mary, you want to ask your question?
Hi, thank you, Alex, and good afternoon, everyone. A question for the panel. How can women get men to be more involved in sharing the child care responsibilities?
Well, which one of you wants to take that first?
I'll jump in. I think this is a huge issue that predated the pandemic, and the data on families and work suggests that women, even when they came into the workforce, have had the lion's share of the childcare and household responsibilities. So I think it's probably more acute during this pandemic. But I will say that the data are also saying that there are many more men who are stepping forward and trying to co-parent. In fact, one of my colleagues who studies non-custodial low-income fathers suggests that they are very active in their children's care. So I want to sort of level the playing field a little bit and say that we are seeing improvements. But what I learned from my clinician friends and my research friends who do this work, my work is on, low income, high risk families, is that sort of understanding that men can make a contribution that is important, even if it's not the same as what women would do, is critical. So, instead of getting upset that they don't wash the dishes the right way or put the kids' socks on when they go outside to play, that in families where this co-parenting works a little bit better is when women are able to accept the help and not feel like they have to control how the help is provided. Also understanding that men might do things a little differently, like the rough and tumble play is a contribution. And although it might disrupt kids' bedtime, it is still a time where children can be with their parents, and it gives women a chance to kind of sit down. Also, there's some research about communication. And again, this is not my area. I'm learning this from my colleagues, that if women are very explicit about what they need, and I know, the first thing that Mary Phelan and other people will say is, why do we have to say it? But the truth is that it looks like when women say, I need your help taking the child to school in the morning, I need your help feeding them at lunchtime, that kind of explicit communication where you get, the two in the couple to say, I'll do this and I'll do that, allows it to work more smoothly.
Professor Berlin?
Yeah, that's good. I would second everything that Dr. Jones Harden just said. And I was thinking especially about, you know, prioritizing as women, as mothers, prioritizing what kind of help is most important. And sometimes the most kind of help is just, you know, that you don't have to do it. But, you know, if that means that someone else is doing it, whether they're a partner or a husband or a grandparent, then if you can be willing to step back a little bit, even if it's not the way that you would prepare the lunch or do the bedtime, that can help a lot.
Okay, Alex, let's
Wow.
meet
Well,
the sparks.
I
I'm
think
not touching this one.
I think you're being very kind to men. I will tell you that. But I think there's a lot more criticism there. But without regard to that, and you did spark a lot of comments on the chat. Lee's son asks me to ask this question for you because she's got some audio problems. She says, both of my kids are under 10. Sometimes I try to set up Zoom meetings for them with some of their classmates, but they don't like that. We only like to interact with a couple of kids that we see often because we live close to them. How do I encourage them to interact with more kids?
Who wants to take that one on? Dr. Jones Harden?
Uh, I'll start it and maybe Lisa can finish. I think there is a difference for children, for all of us, to engage with people virtually versus in person. And I think all of us can empathize with this person's children, and they don't like it. I think, you know, part of peer interaction, particularly for children who are school age, is doing a lot of things that we don't like them to do, touch in the middle of a pandemic, touching each other, hugging each other, holding hands, all the things we don't want them to do. So I understand why this particular mom is trying to encourage the virtual. But if they don't like it, I wouldn't push it. I think having a small hub, a small pod of people whom you interact with is the best way to go. And I would rather, instead of pushing them to do something that really did not feel gratifying for them, allow them to have maybe increased time with that small group of kids that are in a set of families that you trust, that you know aren't exposing their families to all kinds of COVID germs. I would rather increase that time than struggle with children in the middle of a pandemic. I think one of the things that children tell us is what makes them feel okay. And I think at a time when they're in crisis, we have to pay attention to those voices even more and listen even more carefully to what they're saying and enhance the opportunities for them to do that instead of pushing for something else.
Yeah.
Berlin?
Yeah, I would agree with what you just said, Brenda, and you know, maybe think about enhancing the quality of the relationships that these kids currently have for now, and then broadening out, you know, the quantity and the diversity when things get a little safer and maybe they begin to feel a little bit more comfortable.
Okay, Alex?
Well, you know, our audience, there's some expressions here of the research opportunities that present themselves in this unusual time. Catherine Indy has a question in that area. Catherine?
Hi, Dr. Jones-Harden and Dr. Berlin. It won't surprise you to hear this question from me, but I'm curious to know what tools you're using to measure parenting stress during the pandemic. Are you using pandemic-specific measurement tools or relying primarily on the old standbys that we're used to using for measuring parenting stress? And I guess, you know, how are you accounting for the impact of the pandemic on studies of parenting stress during this time?
Well, I can, Lisa, do you want to start or do you want me to start and you?
Either way. I mean, I had some parent surveys going that had started about a year ago. This is in the context of the Baltimore Babies Project, interviewing brand new moms, those who gave birth at one city hospital, Sinai Hospital, about anxiety, symptoms of depression, parenting stress according to the Parenting Stress Inventory, the PSI. So I would call those the old standbys. But what we're able to do is look at moms' responses to those and how they compare to similar samples, studies that were completed and finished pre-pandemic.
Yeah, I always like the old standbys. I love the PSI, as Lisa and Catherine probably know, but I know that Phil Fisher, in his rapid survey project, has developed specific measures just to look at parenting stress during the COVID pandemic. And there have been others like him. I just happen to know his questionnaires well, but there are other groups that have also developed questionnaires that are specific to COVID. And Phil, if you go on Rapid Early Childhood at University of Oregon, he's sharing these questions with the field.
Great, thank you. Alex?
All right, we spend a lot of our day at work. Jenny Owens is here now with a question about what work can do to help.
Yeah, hey, I'm Jenny Owens. I'm in the graduate school. I also run the grid. I have a 4-year-old. I have a 1-year-old. This is my first day with childcare in 14 days. So I'm just so happy to be with you all after a COVID exposure. So I'm part of the President's Council for Women, and we want to, support these moms. We have affinity groups for parents around, 0 to 5 or parents of Black, Indigenous, children of color that are ongoing this year. But like, are there best practices that employers can look to support employees with parenting and caregiving responsibilities, or places that are doing things that are like new and noteworthy in this respect? And also, I am curious personally, what percentage of UMB employees have children, if anybody knows that?
That's a question I've never heard asked, Jenny.
It's like I just asked you all like 20 questions, so I hope you took notes.
That's all right. Which one of you would like to address what Jenny had to say? Lisa?
Yeah, sure. I can get it started. I'd love to know how many of UMB's employees are parents. I don't know, but I bet it's more than half. I mean, it might be easily close to 3/4. But with respect to workplace practices and policies, that's a great question. I mean, I think for starters, just to acknowledge the challenge of the juggling, especially now, is a good start. Providing as much flexibility as possible is a good start. I love the idea of affinity spaces if people have time to participate. I've seen some of those go by, Jenny, and I think that's great. But perhaps also resources devoted to online, if not in person, counseling and parenting specific supports, which, will vary a lot depending on the age of the child or children, the needs of the children, special needs of the children, and, general resources of the family.
Dr. Jones-Harden?
Yeah, I'll just add a little bit to what Lisa said. I really liked her idea of flexibility. I think one of the workplace practices that has gotten the most support is really allowing women to work a different shift. So, and I know that's harder for some jobs than others, but sort of being able to think if women have to be on Zoom to support their children's virtual learning from 9 to 3, can their hours be from 3 to 10, for example? So I think that's important. I also think, thinking about family and medical leave, that issue is an important national issue, but I think it should be an important issue in every employer. When can you apply for emergency family and medical leave if, for example, you've lost your child care, right? I mean, that has happened to a lot of women. Could you potentially get some kind of leave during this time that's a little more flexible until you get childcare? The other thing that some employment places have done is really try to provide safer childcare as part of what they offer as a benefit. So many childcare centers actually are open, and what some people have suggested is the public schools need to learn from child care centers about how to open, because they've learned how to do social distancing. They've learned how to teach children to wear the mask. They've learned how to take the temperatures every morning when kids come in. So thinking about, if not providing the child care on campus, which, as you all know, UMCP has a child care center on campus, but to really maybe support parents to find open child care, I think would be a really good workplace practice.
Alex?
All right, let's go to Esther Glazer. Esther, go ahead.
Hi there. I'm a social worker. I've been on this campus for, oh my gosh, over 4 decades, in a lot of different roles between the School of Social Work and the School of Medicine. My question now is that my UMB community psychiatry residents are seeing a whole lot of solo parenting women from lower SES households. And these women are trying to juggle parenting, homeschooling, working, and even their own learning roles. Other than supportive therapy, which my residents are doing a great job, and sometimes medication for people who need that and it's appropriate for them, are there any community resources that either are tried and true oldies but goodies, or new ones that have been built in response to COVID that are available in Baltimore City to help these women? For most of them, they don't fit into the family connections criteria at the School of Social Work. And a piece of what's been really difficult for these women, but please don't limit your answers to them, is that, for example, one woman has 13-year-old special education triplets, and has 2 part-time jobs, and she's trying to complete an associate's degree herself. And the schools just really aren't stepping up and providing the services they're supposed to be providing. So, but that's just a piece of it. Please don't limit your answers and your knowledge just to that.
Yeah. Again, I'll start, and Lisa, please jump in. I'm still reeling from the 3 13-year-old children with special needs, to be honest. It's hard to move past that. But what I would say is, if I don't know Baltimore well, but I know the home visiting world well, and there are many home visiting programs in Baltimore City and in other places that try to meet parents where they are, which is, of course, the old social work adage. And those programs can help, like part of Maryland Family Network, right? Can help families to get the services that would address their immediate needs, like trying to figure out, is there a program for those 13-year-olds, a youth program that they might have that might give mom a little break from them, but also, helping her to think about what kind of concrete, because, I think implicit in what you're saying is that the psychiatry residents can do a lot for this mom's mental health, but what about the concrete needs she has that's causing the the mental health problems? And I think these home visiting programs, the staff is trained to be able to address both those things. So to be able to connect parents to things that might give them a little bit of relief. So I would encourage you to try to refer them. And if you call the Maryland Family Network, they, have a ton of these programs across the state, but in particular in Baltimore City as well, like Healthy Families and Early Head Start and all those kinds of programs that do provide home visitation.
Professor Berlin?
Yeah, sure. I was also thinking, as you were talking, about Promise Heights and other neighborhood-based initiatives that have just made it their business over the past, 10 to 12 months to pivot and be flexible and patch things together in a very localized, community-based way. So to the extent that families can reach out to their local school, their local houses of worship, there are Herculean efforts going on in so many little pockets around the city, and I would say don't look too far. Look at what's right, in the neighborhood, and there might be some help right on hand that is just not too far out the door.
Great, thank you. Alex, you have an anonymous question.
Well, it's an anonymous question, and actually several people have asked something along these lines. And the question is, what are some of the practical things that we can do to help others? And I will say one of the variants to that question has been, what can women do to help other women, support other women in this?
And Jenny Owens gave us an example of that, of the network that she's put together.
She did, yeah.
Yes. Professor Berlin?
Sure, I can start this one off, and of course, Brenda, chime in. I think one of the most successful strategies I've heard about is women or caregivers of any sex sharing and swapping out responsibilities. So I'll take my kid and your kid today, and you can have them both tomorrow. And today I can get some work done. I can go for a run or a walk. I can just have 30 minutes of peace and quiet. So it's a version of a pod. It requires a little, often a little inter-household commingling, but I think it can be extremely helpful.
I totally agree. And I think, there's a long history of doing that in many communities, including low-income minority communities where, people help each other. And Lisa mentioned houses of worship before. In a lot of low-income communities, these houses of worship can also serve as supports to these women to give them a chance to, they can't, certainly the houses of worship can't have these big meetings anymore, but they've got buildings where they're sometimes letting people bring kids and things like that. But also, we're doing a lot of stuff outside. And in one of the programs that I've worked with, they have actually had parents come meet at a nearby park and just bring the kids, and the programs have supported the parents to bring them all to the spot, and they run around and they all have on masks, but it gives parents a chance to sit with each other in a socially distant way with their masks on, but just to complain and to decide together what might be a strategy they use while the kids are running around with somebody watching them. So I think if somebody's willing to do that, that is great because it allows parents just to sit for a moment. But also at one of the programs that I'm working with, they've been actually giving parents meals because, as you know, particularly for low-income families, the rates of food anxiety have been increased. So they give families meals and they can come pick them up from a particular place and take them home. And it allows for some of the nutritional support that schools have given before to be given to parents. Also little packets that have things that children can use for virtual schooling, and crayons and pencils and paper and all that kind of stuff that they usually get at school and they don't. So things like that are important, and sometimes give a message to families that, somebody cares. And sometimes that's all you need to know, that I'm not out here completely by myself trying to pull this off.
Right. And I know, Jenny Owens, you did an analysis of the different modalities available. Maybe if you get a chance, sign into Alex and let us know what you found in some of those studies. Alex, you got another question?
Well, sure. We have your dean, Judy Postmus. Judy, are you there?
I'm here. Oh, Brenda,
All right.
Lisa's doing such a great job. So thank you for doing this. And you're doing, your job is so great that the questions I posted earlier have already been asked and answered. So I'm going to come up with a new question for you. And so my question is this: what should we pay attention to, whether as social workers, as researchers, as UMB administrators, as we move forward in this next year, as schools start opening up, as the pandemic starts, being addressed with the vaccine? What are some things that we should be paying attention and keep an eye on for the future?
I might start with mental health symptoms. Um, I think they're paramount now, and we shouldn't stop watching them for a while, because I think part of what's happening is that a lot of people who are keeping it together are hanging on by a thread. And it's sort of like the syndrome where a college student gets through their exams and then goes home for winter break and gets really sick with a terrible cold, because they've been using all their resources to get through the semester. And I think a lot of people have been using all their resources to literally to stay alive, to take care of people around them. And they might be getting to a point where just 1 inch of relief is gonna, you know, kind of cause them to hit the wall. So whereas, we might have some more resources now, we should use them to help people who have just been struggling so hard to keep it together, for all this time.
Yeah, I would totally agree with Lisa. I think we should be thinking about mental health, and social workers are very good at that and provide most of the mental health services. So I think Lisa is right on target with that. I would add also that we should pay attention to disparities. I mean, that's something social workers are very good at too. We know when certain groups are not getting the kinds of supports. And we know from all the data that low SES and Black and Latinx families are suffering more from this pandemic in terms of physical health, in terms of mental health, as Lisa talked about, but also, in terms of their kids learning. I mean, I basically feel like, and this is not to be negative about our education system, it's not their fault that they had to pivot to virtual learning, but I think it's absolutely a waste for low-income children. I'm worried that they've lost a year of schooling because of, the digital divide and all kinds of other things that we know a lot about. So I hope that social workers can pay attention to those potential disparities and try to make sure that low income and minority families get even more access to services and intensive services as we, get through hopefully the end of this pandemic, and as children transition back to school, by the way, where they have not had probably the kinds of structure that the school is going to require of them. So it's going to be tough. Like Lisa said, it's going to be hard for them to sit in those chairs when they come back. So really trying to understand what's behind children's acting out behavior and not yell and scream at them for not being able to contain themselves after they've had no structure for a year.
So let me follow up with a question, because you both mentioned mental health as being an issue. And we're a university and people work here and people are under stresses. So how do we be sensitive, be alert to that, identifying that, and attend to that in a responsible manner? Do you have any suggestions for us?
Well, I think certainly anyone who's a supervisor, can be on the lookout, or can be coached to be on the lookout, for struggling supervisees and mentees. And I think, there's going to be just a lot to catch up on. And I think the flexibility, of working when one can concentrate and focus most, will be really helpful. But also just, I mean, I have more than once reminded my students, fellows, mentees, there's a great counseling center on campus. There's a great EAP, Employee Assistance Program. Do you know about that? Can I help you arrange your day so that you can make an appointment there? I think those kind of resources are going to continue to be really essential.
Mhm.
I totally agree. And I also think some of the things that have come out, even of HR now, about self-care, really helping people to understand things about work-life balance, how to take even 5 minutes out of every hour to meditate, to do some kind of breathing. It can be anything, but it needs to be focused on how you take care of yourself in the midst of taking care of children and parents and spouses and people at your job and all those kinds of things.
Okay, Alex, I know you've got a few more
Well,
questions.
yeah, we've got a few more. We've talked a little bit about what an employer can do to help parents, particularly of very young children. Peg McCarthy joins us now, and she has more thoughts about this and maybe what an institution the size of UMB can do. Peg, are you there?
Yes, I'm here. Thanks for the opportunity. This is a great panel. I'm really enjoying it. I do think that there's one sort of missing piece. We've been emphasizing a lot about, supporting women across the campus and at every level, and a lot of emotional support, a lot of suggestions for flexibility and the like. But I think what we're not talking about is that a lot of women on this campus are in the process of building their career. Right? They're either junior faculty, they could be staff who are building their career, they could be graduate students, medical students, nursing, social work, pharmacy, dentistry, they could be postdocs. And what I'm hearing is advice to them of how to just hold on by a thread, right? Here's how to hold on by a thread. And we already are anticipating that there is going to be a massive boomerang of mental health, which I completely agree with. And so what my question is, I think, can we do more? Can we do something that is much more tangible to recognize that they are at risk of falling behind in their career development because they have not received tangible, concrete support, such as many institutions are doing, where they are actually giving out childcare vouchers, or they have subsidized daycare centers on campus, et cetera. And are we not obligated as an institution of this size to actually start to think about real, tangible, concrete things that are proactive in preventing these women from hanging by a thread and actually trying to keep them on track, because they are building their careers not just against other people at this institution, but against women across the country who are receiving more support from their institution.
Thank you for that, Peg. Who would like to start on that one?
Well, I think she was giving a message to the institution, but I'll just add another thing that I've seen done, and I don't think it's hard to do, is sort of be flexible with the tenure clock, and be flexible with, maybe extending the postdoc, maybe saying to people who are in postdoc positions, you can go down to 50% time this year and we'll extend your funding to next year. So you'll be 50% next year. I mean, many women might take that option if it'll help them to do that kind of thing. So I totally agree.
Yeah, I was thinking the same thing. I'm on the appointment, promotion and tenure committee at the School of Social Work, and we've worked with our dean to offer all junior faculty, not just women, the possibility of flexing their tenure clock to have some time to. So that's a real tangible support that, some people have not been concerned with, and other people, I think, have been really grateful to consider.
Yeah, and so Peg, maybe I could make a few comments. First of all, let me address the last two comments. There has been tremendous flexibility, I think, put into the tenure clock. And in effect, what we've said, if you request an extension, it'll be granted. Now, in the past, that was for some reasons such as childbirth or illness, et cetera. But it's been pretty open now to say it could be for these kinds of issues. The other thing you mentioned was postdocs. And although we had a rule in place in the past that said that postdocs could be here no longer than, Peg, you'll correct me, it may be 3 years. And we extended that to at least a year. Now, that was less for the reason you mentioned and more for the reason that people's visas, et cetera, were in jeopardy, and we didn't want them to have to leave their postdoc and run the risk of having to leave the country not knowing whether they could get back. Peg and I and others have talked about childcare on campus for a long time. I wish, Peg, I still had an answer for you. I don't. It is a matter of money and a number of other things, but financially is the big part of it. I guess you just have to keep at me to keep this on the front burner because it's important. I understand it's important. It's just something we've got to find solutions to.
All right. Apart from tenured track faculty and postdocs, some people have mentioned too that, sometimes it's tough if, yes, a flexible schedule can help you hang on, as Peg said, but it also can take you out of the limelight and out of, the position where you can show what you can do to a supervisor who may promote you. So it can be detrimental to a career to step too far aside, even though, that might solve the immediate problem. Let's go to Ashley Vallis. She's at the CEC. She warns me that her mic may not work, but I think it will. Ashley, what do you have?
Can you hear me?
Yes.
Yay! So my children are young, 6, 3, and 6 months. And so I'm, nursing one in the morning while 2 are getting ready for virtual school. And I try to put the news on in the morning so I kind of get a sense of what's going on with the vaccines and, what did I miss? And I look over and, they're hearing about the insurrection at the Capitol and seeing the footage now of the impeachment trial going over and over of violence. And then the story switches to COVID death and illness. And it feels like I should just turn it off because, it just feels so much, especially for the 6-year-old who can kind of understand what's going on now. So I say all that to say, short of just not having the television on when I can watch, which is the news times in the morning or at dinner time, how do you help them process what's going on, what they're seeing on television, that mommy and daddy are safe, that they don't have to worry about us getting COVID or violence, at City Hall, for example, where my husband happens to work sometimes. So, it's those kind of worries on top of everything else that I have with these young kids. Kind of, what are they processing, and how do I help them through that? Thank you.
Who wants that one? Mute, Lisa. Professor Jones Harden.
See, it can happen to anybody.
Yes, I'll start. And Lisa, first of all, I hate to say this, but I would cut it off. And I understand that this is your time, but I might want to do it without the picture showing and just listen to it in a way. I think what children get from the media is sometimes developmentally inappropriate. And I feel like the news is one of those things that's developmentally inappropriate. And I think just listening to you describe what you want your children to hear, that's what I want them to hear. I want them to hear your voice saying, mommy and daddy will be safe. This thing that's hurting everybody, it's gonna get better because the scientists are finding vaccines and everybody. I want them to hear the news from you in a way that I could hear it in your voice, is loving and developmentally appropriate and focused on the positive. I think that's what little kids need to hear and not see the television news. Sorry, I know that's where you get your information.
I just have to say in defense of Ashley, I don't think any of us thought we'd have to turn off C-SPAN because it showed too much violent content. So I mean, that you can understand how that would happen. We have an anonymous question that is kind of
Professor Berlin want to make a comment? Please make a comment.
Oh, no, let's go on. I don't have too much to add to what Brenda just said. I just really empathize, Ashley, with you. You have your hands full, but you're really right. Your instincts are really right to, for you to be the funnel through which your kids experience the outside world, and in as reassuring a way as possible.
Okay, Alex,
All right.
last question.
All right, this is an anonymous question, but it's kind of a big question. It's something we hear about a lot. This woman writes, in many environments, but especially in hospitals, there are disciplines who can't do telework and are expressing growing resentment toward those of us who can telework at times. Often it's female colleagues and supervisors giving their female peers or immediate reports a difficult time. It's difficult to add professional guilt to the existing struggle of constantly failing to achieve this myth of work-life balance and family and pandemic. It's also difficult to comprehend because the pressure is coming from female colleagues mostly. And we have kids too, or, but I'm here, so you should be, is sometimes the rationalization. Do you hear that? What do you think about that?
I have not heard that. That's a tough one. I don't know. It's rough out there. I think that, you know, people who have to work in person, regardless of where they are, deserve as much empathy and support as we can possibly give them. I'll just start there.
Yeah, I agree. I'm very saddened to hear that. I know that sometimes I've heard, even in our world as academics, sometimes women are harder on women academics than they should be in this same way. So I can appreciate it. I feel like that is really unfortunate. And if it were me in that position, I would seek some outside support around it. I mean, there are lots of places in the HR space where you can get support to help with those kinds of things. And that's what I would do if I were in that position.
Tough question.
Yeah.
Tough question. Well, I think we've just about used up our time. Before I thank our panelists, I want to make one announcement, and that is that next week, Wednesday, at 11 a.m., we're having the first in a series of what we called our P4 series, which was presidential interviews with prominent citizens who had insights into politics or current events that were important to discuss before the university. I'm very pleased to announce that Professor Ibram Kendi, who wrote the book that many of you know about, How to Be an Anti-Racist, he will be the featured speaker for that talk next week. And by the way, it won't be a talk. He wants to do full question and answers, which means that you get the opportunity to really get at some of the issues that he's put out in his book and that you maybe have questions about. So one, I want to urge you all to participate in that. It's a special opportunity. If you've read his book, it's got some very stimulating ideas in it, and I hope that you will attend that. So that's happening next Wednesday. So let me finish by thanking Professor Jones-Harden, Professor Berlin. Very tough topic, very interesting topic, and certainly one that I think we all have concerns about. So I want to thank you for donating your time to us for yet another, oh, it's a WebEx, I can't say Zoom, but yet another Zoom type meeting in your busy day. So thank you very much for that. And for those of you who attended, thank you for attending yet again. So we'll see you in next Wednesday. Yes.